September is National Healthy Aging Month, and our population is definitely moving in that direction, aging. In fact, they say the numbers by 2050 are going to be by 2040, that number will grow to 1 in 5 Americans over the age of 65.
Yes, indeed.
So we need to start preparing now to be healthy later. Dr. Jocelyn Burdell is my guest. Thank you so much for coming in.
Thank you for inviting me.
What are your primary goals during the month of September? What's the big message?
Sure, the big message is to be healthy. That's really important in terms of the message that we try to convey to not only our members, but just to the population in general. Social isolation is really a challenge, I think, for a lot of seniors. The National Council on Aging has reported that 1 out of 6 seniors have some type of barrier that prevents them from improving their economic security, as well as having access to some type of community engagement center. And so when you have that many people who are not being connected, that means that they're becoming depressed, they're suffering from poor health. And so we want to make sure that we can take care of those individuals and make sure they have access. And to me, that's the simple solution, is getting them out, getting them transported to centers, ensuring that they have some type of in-home care, as well as providing a series of programs and activities for them in our centers.
How do you reach those people when they are isolated? How do you get to them?
Sure. We've got programs that many, either programs or we've got doctors, social workers who will refer them to our agency, and then we'll be in contact with them. We also know that we've got members in our centers who kind of drop off sometimes, and so we do a telephone reassurance to check up on them, see how they're doing, and seeing whether or not they need some of our other services out of our supportive care team. And so there are ways that we do that. And I think it's also family members just seeing programs like this and knowing to get their loved ones out of the home and getting them to an agency.
There is a correlation, I'm assuming, between being isolated as an elderly person, a senior person, and decline in both physical and mental health, correct?
Yes.
And again, what are some of those things that can happen? Depression, you mentioned.
Yes, depression. There's always cognitive decline, that one of the things that the researchers talk about. And so how do you stop that from advancing? And so, and depression and suicide, it's really getting those individuals out of the home. If possible, or bringing them or bringing someone into the home, as we do with our supportive care team. But if they need transportation, utilizing transportation services to get them to senior centers where they can be socially engaged and they can be involved in educational programs and they can meet new people and have new friends. If I may give you an example.
Please, I was going to ask you
that
next.
I moved here 6 years ago and ended up moving my mother here, who at the time was 83 years old. And the first thing I did was get her connected with 50 Fort. And that was before I started working at 50 Fort, because it had such a reputation for ensuring that our seniors are well taken care of and they remain active. And for her, it was wonderful. I mean, she does yoga. She participates in one of the singing groups at one of the centers. She goes on trips, and she's met new friends. And for someone who didn't know a single soul here in Nashville, it's been really, I think, a lifeline for her.
That's a great story. I was going to ask you for other examples, and what maybe have you seen her health improve? I don't know what her health was like prior to that.
My mother's health has been outstanding.
Outstanding.
And so she's definitely maintained. She just turned 88 last week, and she's still participating in all the things that I just mentioned.
Oh, that's wonderful. What are some of the other activities or educational programs that 50 Forward offers?
Sure. Well, we focus on health and wellness, educational programs, volunteering, and I'm going to forget one right this second, so
That's
I apologize.
Right.
No,
No,
that's
plenty. Yes.
But and so that could be anything. When you look at physical fitness, that could be anything from Tai Chi to Zumba, weight training, those kinds of things, depending on the center. If it's something creative, you could join a theater group, singing group. There are creative writing classes, poetry classes that they can get involved with. If they choose an educational program, we do the Aging Mastery Program, which is a evidence-based program that's done by the National Council on Aging out of Washington, D.C. And so there, it's a 10-week curriculum where they learn anything from physical fitness to navigating relationships with your family to volunteering, financial management. They do all kinds of things in that particular course. And so we've got jewelry making, we have a laboratory program at one of our other centers. And so there are all kinds of things, that they can do. And if we don't do it, and it's something that a group of members want to be able to do, they can. At our Turner Center, they created Genealogy Club because that's what they wanted to do, and it is one of our more popular groups out there at Turner.
And one of the things I think people need to realize, as people age, get older, and they retire, there can be a huge void, and they have more time than they've ever had in their lives to pursue passions.
That's right.
Like genealogy or whatever. Okay, so where are the centers located? Can you kind of give us an idea?
5 are in Davidson County, 2 are in Williamson County. The 2 in Williamson County are College Grove and Martin Center, which is in Brentwood. In Davidson County, we have Bordeaux Center, which is in Bordeaux, Donaldson Station. We also have Knowles and Turner, which is in Bellevue, and then we have...
oh, that's okay. We got the website. That's a lot to remember. No, 50forward.org. For those of you who have got a computer handy, 50forward.org will give you the rundown, the list. I know I've been by the Martin Center many times on my way to Williamson Rec Center to work at, and it's a lovely facility.
It is.
I was in there to speak once. So 50forward.org, and we appreciate everything you're doing. I mean, this is so wonderful. I've learned a lot today about all the programs, and glad your mother's doing so well.
Thank you.
At the young age of 88.
That's right.
It is just a
Thank
number,
you.
truly.
Yeah.
Thank you so
Thank you.
much. Thank you for watching Community Health Matters. You can learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.